السلام عليكم.
Alaikum salam, sir.
Walaikum assalam, Dr. Hani.
Hi, sir.
Walaikum salam.
How are you guys?
Alhamdulillah, doing fine.
So far, so good.
Okay. Inshallah, today we will practice history taking Odibara first part. So, just to remind you, and also for new members who joined the course lately. So, we have 16 stations, complex stable patient, 3 or more for history taking or psychiatry or toxicology. Answer questions, 2 stations, can be counseling. Research, 2 stations. Injured patient means joint examination or system examination, 2 stations or more. Pediatric emergency medicine, so pediatric history taking. Procedural skills, 2 stations. And complex challenging situations, 2 stations, like breaking bad news or difficult referral or a conflict resolution or complaint resolution. Supervise and teach, so 2 stations, like teaching ABG, ACG, nerve block, or anything. The most important domain, clinical reason decision-making skills in all stations, so the management plan. Communication skills, the second important domain, your attitude inside the room, so rapport, empathy, sympathy, and check comfortability, check pain, give questions in pieces, give information in pieces, pausing between pieces, and so on. Share decision with the actor, and so on. Good listening, good eye contact. History taking, organization, the third important domain. Organization, you should be organized in all stations. So our schedule, we will finish history taking first. So we still have today and further 3 sessions for history. After that, psychiatry toxicology 1 session, and resuscitation 3 sessions, 1 for ALS, 1 for ATLS, 1 for pediatric, ABLS and newborn. Practical skills and teaching 2 sessions, system and joint examination 2 sessions, communication skills 2 sessions. After that, we will do mock exams. We finished almost 40 batches, online and face-to-face. Online course more than enough to pass with very high score. Now we are doing the batches for June and July. So practice for June and July batches, and people who joined for September or December or next year, you can attend as listener, no worries. And again, after we finish teaching sessions, we will do mock exams for June and July. Then after June exam, we will do mock exams for July batch. Accuracy means the checklist. You should mention all the points in the general approach. Skillfulness, you should be fluent. And supportiveness means your communication skills, your attitude inside the room. Efficiency structure should be organized, and safety should cover the safety points. The general approach in all history taking, whatever adult or pediatric, same. In psychiatry toxicology, also same, with some modification, okay? So, introduction, and then rubber, then first open question. We have 3 open questions, one in the beginning, and the second one, can you tell me more about that? The third one in the end, would you like to add anything? So the first one, you will ask and stop, let the actor talk. The second one, you ask and stop, After that, you will repeat his answer completely, not partial, okay? Then you will go for Socrates or Odibara or who approach. Today we will practice Odibara, okay? Then associated symptoms. Associated symptoms, we have 8 systems, so you can consider as 4 systems. GIT, urogenital together, dermatology miscellaneous together, cardiovascular respiratory together, CNS and musculoskeletal together. And this depends on the site of the complaint. Depends on the site of the complaint. After that, you will go for general approach. Any past medical disease, any previous surgery, any prescribed medication, any allergy, any disease runs in your family, and then social history, 3 questions. No need to ask about sexual history or travel history at all. Then the third open question, then the concern. What is your concern? Then you will give the diagnosis. Diagnosis, if very clear, mention one diagnosis. If very clear and you have more than one diagnosis, also mention more than one diagnosis. So the diagnosis will be organ. Okay, mention. I'm sorry. According to your data, it seems like problem in your heart or in your brain or in your eye artery or in your leg artery or vein or anything like that. Okay. Then mention the management plan. Management plan, I will give you in observation or isolation or resuscitation. I will do complete general examination, including blah, 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 blah. Mention the special part of examination. I need to do some blood test, including blah, blah, blah. Mention the special tests. Imaging if needed, heart tracing if needed, camera scan if needed. And then check understanding if he has any further questions. Okay. For Odibara, same as Socrates. If you are not concentrating in the exam and you ask Socrates or whatever, not a big issue, don't worry. Okay? Because almost it's the same. So onset, duration, intensity, progression, previous episodes, aggravating factors, relieving factor, associated features. Okay, so don't think about ODIB, no. Think about the questions itself. So how did it start? Sudden or gradual? When did it start? Is it affecting the activities of your daily living? Is it worsening, improving, or the same? Continuous or on and off? Does anything cause or worsen it? Does anything improve it? Then you go for associated symptoms. Associated symptoms 1, 2, 3, 4 in details. The most relevant systems, the 4 most relevant systems in details, and the least 4 relevant systems in concise way. Okay, it depends on the complaint. Clear until here, guys?
Clear, sir.
Okay. So we finished the Socrates last decision. Today we will practice from 10 to 23. So we have throat discomfort. What is the most relevant system here after Odibara?
GI tract,
GIT and urogenital. Dizziness,
CNS,
CNS only?
Musculoskeletal.
CNS and the musculoskeletal. Okay. TIA,
CNS
CNS,
musculoskeletal.
CNS.
Musculoskeletal.
CNS and the musculoskeletal. Vision problem,
CNS,
CNS
and
musculoskeletal.
palpitation,
Cardiovascular
CVS,
respiratory.
and respi,
Thyroid.
respiratory, SOB,
cardiovascular,
Respiratory,
respiratory,
cardiovascular respiratory or respiratory and cardiovascular.
respiratory, and
cardiovascular.
cardiovascular,
Cough.
The same.
respiratory,
I don't want to hear one system, guys. 2 systems. Cough.
respiratory, and miscellaneous,
Why
Cardiovascular.
always,
Cardiovascular.
always cardiovascular or respiratory? Please listen to me, guys. If you want to pass with very high score, you should be good listener. Okay? So, cough, respiratory and cardiovascular. Jaundice,
GI
GIT
tract,
and
urogenital.
urogenital.
okay, rash,
Depend on the
Depends
site.
where the rash, the site.
Site of rash.
depends on the site. Excellent. So, if the rash in the head,
CNS or musculoskeletal.
CNS, musculoskeletal.
if the rash in the chest,
Respiratory
Cardiovascular.
and cardiovascular.
Cardiorespiratory.
if the rash in the tummy,
GI
GI
tract and
urogenital.
genital urinary.
if the rash in the genital areas,
Genital
Genital
urinary.
urinary
Urinary
and
and
GIT.
GI.
if the rash in the limbs,
Musculoskeletal.
Musculoskeletal,
Musculoskeletal and
CNS.
CNS.
if the rash in the back,
musculoskeletal CNS.
Musculoskeletal and CNS.
if the rash in the knee,
Musculoskeletal
Musculoskeletal
And
CNS.
CNS.
okay, excellent. Okay. Urine retention,
Genital urinary and GI tract.
genitourinary or urogenital?
Urogenital and GIT.
Urogenital. Sorry, sir.
GIT. Swollen knee joint,
Musculoskeletal CNS.
Musculoskeletal
musculoskeletal and
CNS.
lower limbs,
Is the same.
Musculoskeletal and CNS.
myalgia,
Musculoskeletal and CNS.
weight loss,
Musculoskeletal and CNS.
Yeah.
Miscellaneous and
Why miscellaneous? Weight loss, weight loss. It means loss of muscle.
yes.
So musculoskeletal. Clear?
Okay.
Next time we will practice Odebara special stations and later we will practice who approach and then pediatric history. Okay, we have for practice Nazar and then Atiq, one, Al-Khansa, Amil, Adil, Tariq, Kavin, Araf, Radhika. Okay, if anyone interested to practice, you can raise your hand at any time. Please mute your mic and the one who practice only can unmute. Okay, we will start by Nazar. Again, for new members, the timing is 1 minute outside the room and 8 minutes inside the room. So for practice online, I will give you 30 seconds before the station and 60 minutes for the station. Okay, you can start the 30 seconds, Nazar.
Okay.
Okay, you can start.
Good morning. I'm Dr. Nazar, A&E Registrar. May I confirm your name and your age, please?
Yeah, I'm Karim. I'm 23 years.
Nice to meet you, Mr. Karim. How can I help you today?
Yeah, I have problem in my throat, doctor.
Oh, I'm so sorry to hear that. Mr. Karim, I'm here to collect some information from you. Is that okay?
Okay.
All right. Can you tell me more about your problem, please?
Yeah, the problem started 3 months ago. Uh, started gradual, increasing, worsening, and continuous.
So it started 3 months ago, increasing, worsening, and continuous. Am I right?
Yes,
Is it affecting your activity of daily living?
yes.
Okay. All right. Is there anything make it worse?
Yeah, if I'm eating or drinking.
Okay. All right. Anything make it better?
No,
And where do you feel the discomfort in your throat? Is it the upper, lower, middle, side,
all.
all? Okay. All right. Do you have any tummy ache?
No,
Did you throw up?
no,
Do you feel sick?
no,
Any yellow discoloration in your skin?
no,
Any yellow discoloration in your eyes?
no,
Any bowel changes?
no,
Do you have any problem in the urine?
no,
Is there any night sweat?
no.
Any temperature?
Yeah, I have mild temperature.
Okay. Any loss of weight?
Yes.
How many kilos?
Yeah, I lost like 30 kilograms within 6 months.
I'm so sorry for that. Any loss of appetite?
Yes.
Okay, all right. Do you have any heart racing?
No,
Any chest pain?
no,
Okay. Have you noticed any changes around your eyes?
no,
Okay. Any hand tremor?
no,
Any shortness of breath?
no,
Any problem with the cold or the hot weather at all?
no,
Okay. Do you have any pins and needles?
no,
Any trauma?
no,
Okay. Do you have any headache?
no,
All right. Mr. Karim, do you have any other medical condition at all?
no,
All right. Uh, have you noticed any lumps in your body?
no. Yeah, I feel I have lump in the front of my neck.
Okay, I'm so sorry for that. Do you have any previous surgery?
No,
Okay. Are you in any prescribed medication?
no, no,
Are you allergic to anything?
no.
Okay. Mr. Karim, where do you live and with who?
My wife in downtown.
And what do you do for living?
I'm teacher.
Okay. Do you smoke?
No,
Do you drink alcohol?
no,
By any chance, do you use any illicit drugs?
no,
Mr. Karim, would you like to add anything?
no.
Okay. And what's your concern?
I'm worried. What is the problem, doctor? Do I need admission, any surgery, any imaging?
Okay. All right. I appreciated your concern, Mr. Karim. According to this information, it seemed the problem is from a gland in your neck. It's called thyroid gland. For that, I need to keep you in observation room. I'll check your vital sign. We'll do general examination. This is include your neck, your eyes, your brain, and nerve as well. We'll request a blood test. This include complete blood count, liver function, kidney function. We'll check the thyroid gland function as well. I request a jelly scan for your neck. It's called ultrasound. And then I have to wait for the result to come back. Also, we need to do heart racing. It's called an ECG. and then according to the result. If everything is came normal, I'll discharge you on printed leaflet for GP follow-up. Do you understand this plan?
Okay.
Are you happy with this plan?
Okay.
All right. Do you have any further question, Mr. Karim?
No, thank you.
All right. Thank you.
Okay, you still have 25 seconds. Okay. Well done, Hazar. So this patient, I denied hoarseness of voice. You did not ask about that. And regarding heart racing, I denied. So the patient has lump in the neck. This lump relevant to thyroid or maybe lump uh, in the pharynx or in the esophagus. What do you think?
It could be both.
It could be both, but since I did not get any symptoms for thyroid, so unlikely to be thyroid. Did you get my point?
Yes.
So no heart racing, no hoarseness of voice. If you ask me, I will deny. So you can say, according to your data, I'm sorry, it seems like mass. So I don't care about anything else. Is it mass relevant to thyroid, mass relevant to pharynx or GIT system, I mean? Did you get my point? So mass.
Yes.
Okay.
Okay.
So according to your data, I'm sorry, it seems like mass in the front of your neck. And this could be to the pharynx or the food pipe. It could be relevant to your thyroid gland in the front of the neck. Easy?
Yes.
Okay. So the same management plan? Yes. So I will keep you in observation room to complete examination, including your throat, okay, and your neck. You will do ultrasound scan and you will do heart tracing. You will do some blood tests, including inflammatory markers, including also the thyroid gland hormones. Okay. And if all are normal, so you will refer the patient to his GP. If any problem in the thyroid gland, so follow up with medical team. Okay. If any problem in the food pipe, so you refer to gastroenterology team. Okay. So
Okay.
I think you covered almost all the points, but I try to optimize your effort. So I will give you 8 out of 10. Well done. Okay. So Atik, okay. So accuracy for Nazar, you almost mentioned 95%. Skillfulness, you are fluent. Supportiveness, empathy, sympathy, and rapport, and you are giving questions in pieces, information in pieces as well. And also you repeated the answer of second open question completely, organized, and you cover the safety points. Well done. Okay, collapse, it could be dizziness, it could be syncope, right? Okay, so collapse here, maybe the patient mean dizziness, maybe he means loss of consciousness. So you will follow the general approach. First open question, maybe he will say collapse. Second open question, maybe he will say collapse only. So after repeating the answer of second open question, so you can ask him clearly, what do you mean by collapse? Is it loss of consciousness or dizziness? But don't ask this question until you find the complaint is not clear. So in the second open question, if he said, I lost my consciousness, no need to ask later, what do you mean by collapse? Clear, Atif?
Sir.
Okay. So if you find the problem is dizziness, you will follow Odibara. If you find the problem is loss of consciousness, you will follow the approach of who approach. Easy?
Yes, sir.
Okay. Anyway, I will make for you dizziness, but I will not mention dizziness until you clarify. Okay?
Okay.
Okay. You have 30 seconds, then 60 minutes. So if dizziness, the most relevant system, of course, sin is musculoskeletal. After that, you will go for cardiovascular respiratory and then GIT urogenital. Okay, you have 30 seconds and 6 minutes. You can start.
Good afternoon. I'm Dr. Atik, ED Registrar. May I know your name and age, please?
I'm Karim, I'm 43 years.
I'm here to collect some data from you. Is that all right?
Okay.
So how can I help you today?
Yeah, I collapsed today.
Mm, I'm sorry to hear that. Are you comfortable now?
It's okay.
So can you tell me more about this collapse?
Yeah, I was watching TV and suddenly I collapsed.
So you're watching TV and you collapse suddenly. Can you tell me more about this collapse? Is it dizziness or is it you had loss of consciousness?
Yeah, like dizziness. I felt everything around me spinning.
Uh, so can you tell me when exactly did you had this dizziness?
At home.
At home? When? Today or yesterday or before 1
The
hour?
problem started 3 days ago. I have these episodes like 15 times till now.
Okay, so you had 3 episodes 15 times before. Do you have any previous episode like this? Mr. Kareem, did you have any previous episode
No, only
like
since the
this?
3 days.
Okay. Is it affecting your daily activities?
No,
Anything that improve it?
no.
Anything that worsen it?
I think when I'm moving or when I'm walking, I feel dizzy. Like now I feel dizzy.
Okay, I'm sorry for that. Can you rest for a while? I need to complete some, I need to ask some further questions. Do you have any headache?
No,
Any jerky movement?
no,
Uh, do you have any history of trauma?
no.
Any ringing in your ears?
Yeah, I feel fullness and the ringing in my ears.
Okay, is it right or both or
Both,
left side?
both.
Both side. Okay. Do you have any weakness?
No,
Do you have any skin changes or rash?
no,
Do you have temperature,
no,
night sweats,
no,
any lump in your body,
no,
any loss of appetite or weight loss?
no,
Do you have chest pain,
no,
any SOB, shortness of breath,
no,
cough,
no,
any change in your bowel movement,
no, no,
any changes in your urine?
no.
Mr. Kareem, do you have any past medical disease?
No.
Any surgical history?
No.
Do you have any disease around your family?
No.
Are you taking any prescribed medications?
No.
Do you have any allergy?
No.
Mr. Karim, I need to ask you some personal questions, which we ask routinely. Where do you live and whom do you live with?
My family in downtown.
Okay, what do you do for a living?
Teacher.
Do you smoke,
No.
drink alcohol?
No.
By any chance you use illicit drugs?
No.
Would you like to add anything?
No.
What is your concern,
I'm worried. What
Mr.
is
Karim?
the problem? Do I need admission or imaging?
I appreciate your concern, Mr. Karim. According to the data I have collected from you, the most likely problem is with your inner ear. But the good news is it looks like benign. So for now, I need to keep you in observation room, do your physical exam, including your exam of your brain, nerve, and do a special test called disc K. Are you with me? Do you understand, Mr. Karim? Mr. Karim, do you understand?
Okay.
So for now, I will give you some supportive treatment also. And if it will improve, it's good. If it does not improve, we might do a Epley maneuver. Do you understand, Mr. Karim?
Okay.
Anything you want to ask?
Okay, thank you. Okay, you still have 14 seconds. Okay. Well done, Atiq. What do you think, guys? How many marks for Atiq?
10 marks, sir.
Okay. Did he mention Robert? Did he say nice to meet you?
No, sir, I forgot.
No. Okay. So in any station, you have to mention that. Nice to meet you. Nurse, patient, anything. So may I know your name and the grade, or may I know your name and age, if patient or nurse or junior doctor? After that, nice to meet you. Sympathy you covered. Check comfortability, pain. Did you move the patient from the beginning to resuscitation room or at least to observation room? No.
Mm.
Okay. So,
To
huh?
also,
Sorry?
business also, we need to move it to observation immediately.
Any patient with collapse, is it serious or not serious?
Yes.
Serious. If you don't want to move to resus, at least move to observation. Clear?
So,
Okay. So I need to move you now to observation room to be sure that you're okay. When I said this happened when I'm moving my head or walking, now I feel dizzy. I felt you don't care. Okay. So you can say, oh, sorry. Can you lie flat? Are you comfortable now? But you did not care, right? Can you hear me, Atik?
yes, sir.
Please answer me. Be active with me. Okay.
I,
N- No need to
mm,
unmute your mic.
sir, I said that are you sitting comfortably or something like this?
No, you should say clearly and your voice should be audible. Your voice should be clear to the examiner. Okay? If you are
Mm.
doing anything and it's not clear, what is the benefit? Right?
Yes, sir.
So, oh, sorry. Do you have dizziness now? So, can you lie flat? Are you comfortable now? If he is comfortable, okay, no need for medicine. If he said, no, I'm not comfortable, okay, I will give you some medicine now to make you comfortable. Are you okay now? Like that. Easy?
Yes, sir.
Okay. No need to mention the name of the medicine. They are not testing your knowledge. They are testing your skills, how you will deal with patients, how you will make patients comfortable. Okay? How you care about comfortability. So comfortability, it's not about pain only. If the patient has chest pain and you will address the pain, it means you are supportive. If the patient has dizziness, you have to address dizziness also, right?
Yes, sir.
So you address the symptoms, not only the pain. If the patient has heart racing, you have to address heart racing before history. Okay. So I think accuracy, you covered almost all the points. Regarding skillfulness, you are very fluent. Supportiveness affected 90%. Efficiency structure, you are very organized. And safety, you did not move the patient in the beginning, and you don't care about comfortability. So safety 90% also. So I will give you 8 marks out of 10. Okay. Regarding this patient, you did well, but I will optimize the management plan. You can say, according to your data, it seems like a benign uh, condition. Okay, it seems like problem in the inner ear, which is called in medical term vertigo. Okay, this is benign paroxysmal positional vertigo. Okay, so what you will do, the same as you mentioned, you did well in management plan. So you will do a special test. Of course, you will do complete examination, including the ear, nose, and throat. And you will examine the brain, nerves, and the back of the eyes to rule out any serious problem. Okay. You will do special test to support the diagnosis, which is called in medical term textile pipe test. And you will discharge the patient with printed leaflet, discharge a letter to GP, and return if any worrying symptoms. Return if any worrying symptoms. Okay. So if the patient return, you can do a special maneuver, which is called Eble maneuver. Okay, well done. I think you covered almost all the points. Safwan,
Assalamualaikum, sir.
how are you?
I'm fine. How are you, sir?
Okay. Vision problem. What is the most relevant system?
CNS.
CNS and musculoskeletal.
Okay. So in Socrates, you can ask, are you comfortable? Do you have any pain? In Odibara, you will ask, are you comfortable? Do you have any pain? Do you still have vision problem? Clear now?
Yes, doctor.
Again, in Socrates, you will ask about pain only. But in Odibara, you will ask about the pain and the complaint. Clear?
Yes, sir.
So in Socrates, are you comfortable? Do you have any pain? He doesn't have any other complaint. That's why we ask about pain only. But here, the patient has vision problem. So you should ask about comfortability, pain, and the vision problem. Okay. Again, so are you comfortable? Do you have pain? Do you still have vision problem? Why I'm asking this question? Because if the patient still have vision problem, it's not TIA. If the patient has no more vision problem, it's a TIA, right?
Yes, sir.
So you ask about this question when you are checking comfortability. Okay. Here in Rosier score, you will find CNS system. What is the most relevant system? CNS and the musculoskeletal. So Rosier score, it's CNS and the musculoskeletal. So loss of consciousness, it's a CNS. Seizures, CNS. And weakness, musculoskeletal. Speech disturbance, CNS. Vision field deficit, no need to ask because already he said I have vision problem. So in visual field deficit, you will ask about vision symptoms. How? So you will ask any redness in the eye. What about the vision problem? Is it blurring of vision? Is it complete loss of vision? Or just the halos around the eye? Clear, Safwan?
Yes, sir.
So questions will be, did you lose your consciousness? Any jerky movements? Any weakness in your face, arm, or leg? Do you have any speech problem? What about your vision problem? Is it blurring of vision? Is it complete loss of vision? Or just the halos? Any redness in the eye? Any discharge from your eyes? Okay, clear now?
Yes, sir.
By this way, you covered rosacea. Okay. So if they said, yes, I still have vision problem, it means problem in the eye. It could be artery or vein or nerve. If the problem is sudden, painless, it could be artery or vein, central. If the problem painless, artery or vein. If the problem painful, it could be nerve. Easy?
Yes, sir.
Okay. So you have 30 seconds and 6 minutes.
So redness.
Okay, you can start.
Good evening. I am Dr. Safwan, one of AD doctor. May I know your name and age, please?
Kareem, 43.
Nice to meet you, Mr. Karim. Today I want to collect some data from you. Is that okay with you?
Okay.
How can I help you today, Mr. Karim?
Yeah, I have vision problem, doctor.
Oh, I'm sorry to hear that. Are you comfortable now?
It's okay.
Okay. Are you still, do you have any vision problem?
Yes.
Okay. Can you tell me more about this condition, please?
Yeah, the problem started suddenly. I was at home and I was watching TV and I felt suddenly I cannot see.
Okay, so it is started suddenly, and is it it started today? Am I right?
Yeah.
Uh, is it affecting your daily activities of living?
Yeah, I was worried. I called the ambulance. They brought me here. They couldn't drive.
Okay, that's good. So, Mr. Karim, is it worsening or improving with time?
Same.
Same. Okay. So it that condition, it is on and off or continuous?
Continue.
Okay. Did you have any previous episode like this?
No, no, this is the first time.
Okay. Does anything worsen it?
No,
Does anything improve it?
no,
Okay. Mr. Karim, do you have any headache?
no, no,
Any jerky movements?
no,
And did you lose consciousness?
no,
And did you have any weakness of your body or face?
No, no.
Did you have any speech difficulties?
No, no.
Regarding your vision, is it complete loss of vision or partial?
Complete loss of vision.
Is it which side? Is it right or left?
Right.
Okay. Did you have any redness in your eyes?
No, no.
Any discharge?
No.
This vision loss, it is painful or pain? Do you have any pain in the eyes?
No, no, no pain.
Okay. And so, did you have any trauma?
No, no.
Do you have any rashes?
No.
Do you have any temperature, high temperature,
No.
night sweats?
No.
Any lump in your body?
No.
Did you lose weight?
No.
Did you lose appetite?
No.
Regarding, do you have any chest pain or heart racing?
No.
Any breathing difficulties?
No.
Any tummy pain or bowel problems?
No.
Urine problems?
No.
Okay. So, Mr. Karim, do you have any past medical disease?
No.
Any past surgeries you undergone?
No.
Are you on any prescribed medication?
No.
Do you have any allergies?
No.
Is there any family disease running in your family?
No.
Okay, Mr. Karim, I want to ask some personal questions we ask in every patients in the ED. What do you do for living?
I'm teacher.
Where do you live and with whom?
My wife in downtown.
Okay. Do you smoke, Mr. Karim?
No.
Drink alcohol?
No.
By any chance consume illicit drugs?
No.
Okay. Do you want to add anything, Mr. Karim?
No.
What is your concern, Mr. Karim?
What is the problem, doctor? Do I need head imaging or any surgery?
Okay, I appreciate your concern. So, according to your data, this is unlikely to be a problem in your head because you didn't have any headache or weakness or body weakness. And but I will take you to the observation room and I will do examination including brain nerves and also examination of back of your eyes. And if okay, and so in the examination of back of your eyes, I am sorry to say I find a blood clot in the artery of your eyes. It is called central retinal artery occlusion in medical terms. So what I will do is I will do a gentle massage of your eyeball and I will give you a medicine to keep below the tongue. It is called nitroglycerin. And also I will put eye drop called timolol. And also I will give a medicine through your vein, which is called acetazolamide. And also it should be seen by eye doctor, and I will refer to you eye doctor now. Am I clear to you?
Okay, thank you. Your time done.
Okay, thank you.
Okay, excellent, Safwan. What do you think, you guys? How many marks for Safwan?
10 marks, sir.
Okay, I think he covered almost all the points and he's perfect. Um, Regarding the diagnosis, he said unlikely to be problem in the head, but he did not mention the diagnosis. Clear, Safwan?
Yes, doctor.
Which is logic? To start by the likely problem or the unlikely problem?
likely problem in the eyeball.
Yes. So you should start by the likely problem and then the unlikely problem. It's okay. But you did not comment on the likely problem. Okay.
Yes.
You said it's unlikely to be a head problem because blah 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 blah. And then you jump to what you will do. And then you jump to after I show you the slide, you jump to the likely problem. Clear now?
Yes, doctor.
It should be like that. According to your data, I'm sorry, it seems like even without examining the back of the eyes, yes. I'm sorry, according to your data, it seems like problem where in the central artery or vein in your eye, right side. Clear now?
Yes, doctor.
Without slide, yes. Because already it's painless and the sudden and the complete loss of vision and no redness, no discharge. So for sure, it's artery or vein. Easy.
Yes, sir.
If redness and the painful, think about something serious. Like what? Like uh, anterior uveitis, like optic neuritis, anything like that. Okay. So I think you covered almost all the point. I'm trying to optimize your approach. So you can mention the diagnosis of artery or vein before the examination of the back of the eye? Yes. And then they will show you this slide according to your examination of the back of your right side of the eye. I'm sorry, it seems like occlusion, blood clot in the central artery. So what I will do now, blah, 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 blah. I think you covered the management plan very well. Okay. So regarding Rosier score, you covered in CNS system and the musculoskeletal system. Well done. So loss of consciousness, jerky movements, weakness in face, arm, or leg, any problem in speech. What about your vision problem? Is it blurring of vision or complete loss of vision or just a halos? Any discharge, any um, redness? So perfect. You did well. So accuracy, you almost mentioned all the points. Skillfulness, you are very fluent. Even you are not fast, even you are not fast, but you finished your station, you reach the end of the task. Supportiveness, very well. So you are giving um, rubber empathy, and check comfortability, and you check also the pain, and you check if she still has vision problem. Give questions in pieces, information in pieces, give clear diagnosis, give clear management plan, efficient structure, very organized, and safety. You cover the safety point. So I will give you 10 out of 10. Okay.
Okay. Thank you, sir.
Yeah, well done. Okay, next one, Khansa Abdullah.
Yes, Assalamu alaikum, Dr.
Alaikum
Han.
salam, how are you?
Good, alhamdulillah. How are you?
Okay, the same station, vision problem, but this time I will change the diagnosis for you. Okay, so in last station, do you are you comfortable? Do you have pain? Do you still have
Yeah.
vision problem? I said yes. Here I will say no. Okay,
Okay.
so when you ask, are you comfortable? I'm comfortable. Do you have pain? No. Do you still have vision problem? No. So the patient has no problem at the moment. So when you ask about Rosier score, you can say you are comfortable now. When you got a vision problem, of course after Audubon, when you got a vision problem, did you lose your consciousness? Did you get my point?
Yes.
Not logic if you say uh, any weakness, because he doesn't have weakness at the moment. I wish it's clear for you.
You mean I should not ask about this weakness or weakness or leg weakness?
No, I'm not asking about present weakness. I'm asking about past weakness.
Okay.
Because TIA, the patient is good now.
Oh.
He has these symptoms at the time of the problem. Clear?
Mm.
I wish it's clear. What does it mean TIA?
Transient ischemic attack mean there is
Problem in the eye,
problem. Yeah.
problem in the eye or in CNS. Clear?
Yes.
And this problem improved, resolved.
Yes.
So not logic to say, do you have weakness in your face? He will say no, because now he's good. But he has weakness maybe 2 hours ago.
Mm-hmm.
Did you get my point?
Yeah, I should ask, did you have weakness before, like this? Yeah.
Yes. When you got this event, did you lose your consciousness? Did you get jerky movements? Did you get uh, weakness in your face, your arm or leg? Did you get any problem in speech?
Okay. Yes.
Clear my point?
Yes. Clear.
When you get this event, what is the problem in vision? Is it blurring of vision? Is it complete loss of vision or just halos? Easy?
Yes.
So any problem in the weakness or in the speech or in the vision, it's called stroke if more than 24 hours. If less
Yes.
than 24 hours and the result, it's called TIA. Easy?
Yes.
Okay. So you have 30 seconds and 6 minutes. Okay, you can start.
Hello, good afternoon. I'm Dr. Alkansa, one of ED doctor. May I confirm your name and age, please?
Yeah, I'm Karim. I'm 43 years.
Nice to meet you, Mr. Karim. How can I help you today?
Yeah, I have vision problem, doctor.
I'm sorry to hear that. Are you comfortable? Uh, are you comfortable?
Yes.
Uh, do you still have a vision problem?
No.
Okay. Mr. Karim, how can I help you today? Could you please tell me more about your vision problem?
Yeah, the problem started 1 hour ago. I was watching TV and suddenly I got vision problem.
Okay, as you said, your vision problem started 1 hour ago when you were watching TV. Suddenly, is that right?
Yes.
Okay, Mr. Karim. Uh, how did uh, how did it start? Sorry, it is worsening or improving?
Yeah, improved. I don't have any problem now.
Okay. Did you have same problem before?
No,
Anything make it better or worse?
no,
Uh, did you loss of consciousness?
no, no,
Uh, did you have any weakness when this happened to you?
no, no,
Did you have any jerky movement when that happened to you?
no,
Uh, did you have any redness of eye?
no.
When Mr. Karim, when lost your vision, it is complete or not partial?
Complete loss of vision.
Oh, I'm sorry to hear that. Okay. Did you have I'm sorry. Did you have any sorry. Did you have any numbness?
No.
Did you have any did you throw up?
No.
Any sick?
No.
Did you have shortness of breath,
No.
heart racing?
No.
Did you do you have any bowel change?
No.
Did you have any high temperature,
No.
weight loss,
No.
any lump on your body,
No.
any skin rash?
No.
Do you have any urine problem?
No.
Okay, Mr. Karim, do you have any previous medical disease?
No.
Any previous operation?
No.
Any prescribed medication?
No.
Any allergy?
No.
There any disease running in your family?
No.
Sorry, Mr. Karim, I want to ask you some personal question. When do you live and with whom?
With my family in downtown.
Okay, did you smoke? Do you smoke?
No.
Drink alcohol?
No.
By any chance, do you use any illicit drugs?
No.
What do you do for a living?
I'm teacher.
Okay. Mr. Karim, would you like to add anything?
No.
Mr. Karim, what is your concern?
What is the problem, doctor? Do I need head imaging? Do I need admission? Any surgery?
Okay, Mr. Karim, I appreciate your concern. I will keep you in observation room, and I will examine you, including I will do full physical examination, including your brain, nerve, and posterior eye, and I will do some blood test, including blood profile, and I will consult our brain team, because according to your data, you have a problem in your vessels of your brain, and it is transient. Okay, Mr. Karim, did you understand?
Okay. Thank you. Your time done. Okay. What do you think?
No, I am not good today.
No, you're doing very well. Okay. What do you think, guys? How many marks for Alcanza?
9 marks, sir.
Okay. So this patient needs imaging or not?
No need.
No need.
No need.
According to data, no need. But maybe on examination, the patient needs, right?
Yes.
Yes, sir.
Yes.
We cannot rule out brain nerves and the back of the eyes from history only, right?
Yes.
Okay, so you can say, according to your data, it seems like problem in your brain. I'm sorry to say that. It was small blood clot in the vessels in your brain, and it resolved. That's why you don't have symptoms anymore. Easy?
Yes.
Okay. According to your data, you don't need imaging at the moment. You see, I said according to data. I did not say according to examination. Okay. According to your data, you don't need imaging at the moment, but I need to keep you in observation room, do complete general examination, examine your brain, nerves, and the back of your eyes. Easy?
Yes.
So fix this management plan in any CNS complaint. I mean, how can I help you? I have vision problem. How can I help you? I have headache. How can I help you? I have anything relevant to the brain. So you should fix this management plan to any complaint relevant to CNS. Easy?
Yes. Yes.
Okay. But I need to keep you in observation room, do complete general examination, including your brain, nerves, and the back of your eyes. If I find all examination normal, I will discharge you with printed leaflet. Any discharge fixes this discharge management plan to any discharge. I will discharge you with printed leaflet, discharge a letter to your GP. And the follow-up with which clinic, guys?
OSCE is
CIA clinic.
TI.
Yeah.
Yes, excellent. Okay. So the charge with the charge letter to your GP, printed leaflet, return if you have any worrying symptoms, and follow up with the IA clinic. Okay. The new guidelines, again, new guidelines say no more low or high risk. All same. Okay. So the patient has low risk or high risk, you will follow the same management plan. Why? If the patient has no symptoms now, it means he doesn't need imaging now. He has no symptoms. Whatever low risk or high risk, he has no symptoms. Why I will do imaging? Okay. If you will do imaging, you will not find anything because he has no symptoms now. If he has anything in the brain, of course he will get symptoms. Okay, anyway. So again, the new guidelines, low risk or high risk, you will follow the same management plan and follow up within 24 hours. Low risk or high risk, I don't care. So high risk like what? The patient has irregular heartbeat. So if you ask the patient, do you have heart racing? He said yes. So it's a high risk. Okay. If you ask the patient, do you have some problem before? Maybe he will say yes 3 times this week. So it's a high risk. Okay. So if the patient has weakness in the face, weakness in the arm, weakness in the leg, speech disturbance, vision problem, and the result, it means high risk. Okay. So do you have face weakness? Yes. Any weakness in the arm? Yes. Weakness in the leg? Yes. Now he has no weakness, but he has weakness earlier. So it's 1, 1, 1, 1, 1. So more than 3, it's a high risk. So anyway, the management plan same. Okay. So you did well, Franza. So I will give you 9 out of 10. Okay.
Thank you, Dr.
Yeah, well done. Keep that. Please, guys, write the general approach in front of you when you are practicing. And I will be happy if you will do good approach even from the paper, no problem. Again, today you will practice from paper, and tomorrow be sure you will practice from your mind. You will be perfect in real practice also. When you take history from any patient in real practice, be sure you will do very well and you will understand how you get history from patient. Okay, next one, Tamim.
Yes, sir.
Yes. And always keep paper and pen in front of you guys. Any point I will mention, you can write because you will not remember everything. Okay. You have 30 seconds and then 6 minutes.
Okay, sir. Can I start, sir?
It's up to you. You can.
Okay, good evening. I'm Dr. Tamil. I'm the ED registrar. May I know your name and age, please?
Yeah, I'm Karima. I'm 43 years.
Nice to meet you, Mrs. Karima. How can I help you today, Mrs. Karima?
Yeah, I feel my heart is racing.
I see. I'm sorry to hear that, Mrs. Karima. Are you comfortable right now?
Yeah, it's okay.
Do you still having the heart racing?
No, no more.
No more. Okay. Mrs. Karima, I think I will move you to the resuscitation room, connect you to the heart monitor, and to check your vital signs to make sure that you are okay. And then I will do a heart tracing for you. Is it okay?
Yeah.
Okay, Mrs. Karima, can you tell me more about your heart racing?
Yeah, the problem started 1 month ago. It's increasing, worsening. It's on and off.
I see. So you're telling me that the heart racing started 1 month ago and it is increasing and worsening. Am I right, Mrs. Karima?
Yes.
Okay, Mrs. Karima, is it a continuous or is it on and off?
On and off.
I see. Is this heart racing affecting the activities of your daily life?
No, no.
Okay. Anything improves it or worsen it? Do you have the same problem before, Mrs. Karima?
No.
Um, okay, Mrs. Karima, when you have this heart racing, do you have chest pain?
No, no.
Do you have difficulty to breathe?
No.
Do you have dizziness?
No.
And Mrs. Karima, when you say this heart racing, is it fast?
Yeah, I
Is
feel
your heart,
it's fast, yes.
is it regular or irregular?
No, I feel it's regular.
It's regular, I see. Okay. Mrs. Karima, do you have difficulty to breathe?
No.
Do you have any heat intolerance?
No.
Okay. Mrs. Karima, do you have any change in bowel habit?
No.
Any, did you throw up?
No.
Any temperature?
No.
Okay, Mrs. Karima. Do you mind telling me, did you have any past medical history?
No.
Any previous surgery?
No.
Mrs. Karima, do you have any prescribed medications?
No.
Any allergy?
No.
Mrs. Karima, when was your last menstrual period date?
Yeah, I think 5 weeks ago.
5 weeks ago, I see. Okay, Mrs. Karima, did you check for pregnancy?
I did not.
You did not. Is it a regular menses?
Yes.
I see. Okay. Mrs. Karima, any disease that runs in your family?
No.
Whom do you live with and where do you live?
In downtown with my family.
Mrs. Karima, do you smoke, drink alcohol?
No.
By any chance, do you use any illicit drugs?
No.
What do you do for living, Mrs. Karima?
I'm teacher.
Mrs. Karima, would you like to add anything?
No.
What is your concern, Mrs. Karima?
I'm worried. What is the problem, doctor?
Okay, Mrs. Karima, according to the data that you have given me, I think you have a heart racing, but from the information that you have given me, that's not a clear cause. So for this reason, but I will of course I will need to rule out if there's any problem in your heart. For this reason, I will continue to keep you in the resuscitation room. I will do complete examination, including your heart, your lung, okay, and also your neck examination, and then I will do a send blood test, including a heart function and then a thyroid gland blood test. And Mrs. Karima, we have done a heart tracing for you, and based on your ECG, looks like you have a trifascicular block. So for this reason, I will do a blood test, including the heart function. Okay, and then because you told me that your last menstrual date is 5 weeks ago, I will also need to check you for do a pregnancy test for you, and then once all these blood results are out, and then and based on the ECG, seems like the problem in your heart, I will call the heart doctor, and then we will, and then the heart doctor might want to put you a small device in your chest to protect your heart from irregular heartbeat. Do you understand, Mrs. Karima?
Okay.
Any further questions?
No, thank you.
Thank you.
Okay, your time done.
Okay, doctor.
Okay, well done. So
Thank
what do you
you.
think, you guys? How many marks for Tamil?
10.
10 out of
Okay, she covered almost all the points. She did not forget about last ministerial period. So this patient has heart racing. You said, are you comfortable? Do you still have heart racing? And you did not ask about pain.
Yeah, doctor.
So it should be like that.
Okay.
Are you comfortable? Do you have any pain? Do you still have heart racing? That's it. In previous station, are you comfortable? Do you have any pain? Do you still have vision problem? And so on. Okay.
Okay.
So the patient has last menstrual period 5 weeks ago. You ask, did you test for pregnancy? Well done. Maybe she will say yes. If no, so you can do pregnancy test as well. So according to your data, it seems like you have heart racing, so maybe the problem uh, relevant to your heart or maybe relevant to your pregnancy. It could be
Okay, doctor.
something like anemia. Okay, so if you have two diagnoses mentioned by this way, okay. So what will I
Okay.
do now? I will keep you in observation or resuscitation room. I will do keep you connected to heart monitor and do heart tracing for you. I need to do examination, your heart, lungs, and some blood tests, including heart functions and pregnancy test as well. Okay. If they show you the heart tracing, um, even you don't know the diagnosis, but you feel there is problem, you can say, I'm sorry, according to your heart tracing, it seems like problem in the heart. For this reason, I will call the heart doctor, cardiologist. He might do pacing for you. So if you are familiar with the ECG, you can say there is problem in the heart, which is called in medical term trifascicular block. Okay. So this pacing will protect uh, your heart. Okay, well done. So I will give you 9 out of 10. Okay,
Thank you, doctor.
well done. Okay, Radhika.
Yes, Dr. Hani. Good evening, sir.
Mhm. Okay, SOB. So what is the most relevant system?
Respiratory and cardiovascular system, sir.
Okay, excellent. So you have 30 seconds, then 6 minutes.
Okay, sir. May I start, sir?
Okay, you can start.
Good morning. I am Dr. Radhika, ER Register. May I confirm your name and age, please?
Karim, 43.
Nice to meet you, Mr. Karim. So, how may I help you today?
Yeah, I have shortness of breath, doctor.
Oh, I'm so sorry to hear that. Are you comfortable right now, or do you still have some shortness of breath?
Yeah, I have shortness of breath now.
Okay. I would like to move you to resuscitation room, connect you to all the monitors, including oximetry and your heart tracing, to make sure that you're okay. Is it fine?
Okay.
Okay. So, nurse, please connect the patient to the all heart monitors, pulse oximetry, and let's make sure that he's fine. Are you fine, Mr. Kareem, now?
No, I have shortness of breath.
Okay. We will start you with some oxygen by a face mask. Nurse, please start the patient with oxygen by face mask. Are you okay, Mr. Kareem, now?
Yes, I'm okay now.
Okay. So now I would like to ask you questions. Is that okay, Mr. Kareem?
Yes.
Okay. So can you tell me more about this shortness of breath?
Yes, I was playing football and suddenly I felt severe shortness of breath.
Okay, so sorry to hear that. So you mentioned to me that you were playing football and it started suddenly. Can you tell me since how much time this shortness of breath is there?
1 hour ago.
Okay. And did you have to stop playing football? Like, did you disturb your activities? Is it continuous and worsening?
Worsening.
Did you have any similar episodes in the past? Kareem? So, is there anything that making this shortness of breath worse, or is it anything that making it better?
No,
Okay. Uh, do you have any cough, Mr. Kareem?
no,
Okay. Do you have any chest pain, heart racing?
no,
Okay. Do you have any dizziness?
no,
Okay. Do you have any rash or skin changes, Mr. Kareem?
no,
Okay. Did you have any high temperature, any lump or bump in your body?
no,
Okay. Was there any loss in your weight or loss in your appetite in few days?
no,
Okay. Uh, did you have any change in your bowel habit?
no,
Okay. Any change in the urine?
no,
Okay. Do you feel any numbness or any weakness in any of your limbs?
no,
Was there any trauma anywhere in your body?
no,
Do you have any headache or any loss of consciousness with that?
no,
Or did you have any vision problem?
no,
So, do you have any past medical problems, Mr. Kareem?
no,
Okay. Any history of any surgery in the past?
no,
Any disease runs in your family, Mr. Kareem?
no,
Are you on any prescribed medications?
no.
I would like to ask you a few personal questions, which are uh, routine questions which we ask in an emergency. So, where do you live and with whom, Mr. Kareem?
My family downtown.
Okay. Do you use any illicit drugs, drink alcohol, or smoke?
No,
Okay. And what do you do for living, Mr. Kareem? What do you do for living, Mr. Kareem?
I'm football player.
Okay. So, Mr. Kareem, you told me that you had shortness of breath, which started during your football play, and it's worsening and it's continuous and it's increasing. Uh, would you like to add anything to these things?
Yes, I have wheezes also.
So, I would like to ask you a couple of questions about these V's. Did it start while you were playing football? Have you had any such complaints or wheezing in the past?
No.
Okay. Um, I'm very sorry to inform you. Do you have any concerns or any concerns, Mr. Kareem?
What is the problem, doctor? Do I need imaging in admission? Thank you.
I appreciate
Your time back. Thank you.
Okay. Thank you, Dr. Hani.
Okay. I will give you 30 seconds. You can continue.
Okay, Dr. Hani. So, yes, I appreciate your concern, Mr. Kareem. So, from your data I have collected from you, I feel that it could be a problem like wheezing and shortness of breath. It could be related to your exercise. It could be like in a medical term, we call exercise-induced asthma. For further management plan, I would like to check your general vitals, check your chest for different sounds, also check your cardiovascular heart. And according to the examination details, we can decide on further management.
Thank
We
you.
will need to get in.
Good.
Thank you, sir.
Okay. You are doing very well, but try to concise your approach. Okay.
Okay, sir.
Um,
Yes, sir.
even in the management plan, no need to talk too much. So, according to data, I'm sorry, it seems like narrowing of the airway passages, which is called bronchial asthma. I will keep
Okay.
this room. I will do examination for your chest. More than enough. Okay.
Okay, sir.
Some
Yes.
oxygen and some medicine to dilate the airway passage. Done.
Okay, sir.
So you will do some blood tests, including blood gases, and according to the assessment, according to the improvement, we will see if you need admission or you will be discharged. More than enough. Easy?
Yes. Yes. Yes, sir.
So try to concise your approach always. Okay. Even
Okay, sir.
the most relevant system here, respiratory. Did you ask about wheezes?
No, sir. I did not ask about that.
Why I
Sorry.
wheezes when you ask me, would you like to add anything? Okay. So
Yes, sir.
the patient has respiratory problem, it means the key to catch the diagnosis in respiratory system. Okay. So
Yes, sir.
any wheezes, any cough, um, and if the patient said yes, I have cough, so is it with blood? Okay. So
Yes, sir.
if the patient said yes, I have cough, is it dry or productive? If the patient has no cough, unlikely to be pneumonia, unlikely to be infection, clear? Unlikely to
Yes, sir.
malignancy, okay? Uh,
Yes.
the patient has cough, so you should ask, is it dry or productive? If productive, what is the color of sputum? Clear now?
Yes. Yes, sir.
So the key to pass any history taking station in the most relevant system. If you miss any point in the most relevant system, it will affect your approach, okay?
Yes, sir.
Okay, well done. Okay,
Thank you, sir.
so I will give you 8 out of 10, okay? You
Thank you, sir.
the end of the task. Okay, well done. Of course, in the exam,
Thank you, sir.
you will find 8 minutes, more than enough. Even you are slow, you will catch the end of the task for sure. Okay, thank you.
Definitely, sir. Thank you, sir.
Osha?
Yes, sir. Good evening, sir.
Mhm. So the
So I also had a doubt regarding the previous station, the one we just did. So apart from oxygen, like, can we offer bronchodilators
until
at this point?
we don't know the diagnosis.
Okay, understood. Yeah.
We don't know the diagnosis. So any patient